Morning, this is Dr. Morgan and I am with Chambers Medical Group. I'm an orthopedic surgeon. And I was noting the other day that people come in and they rarely can specifically identify to me what body parts have been injured. What we like to establish is something called a differential diagnosis, and in that regard we can hone in on the exact diagnosis. Today we will go over some of those techniques. So the areas of the wrist that we discussed earlier involve the radial side of the wrist, which is the thumb part of the wrist, and the ulnar side of the wrist, which is the little finger part. It's called the ulnar side because this bone is called the ulnar, and the ulnar nerve, which we're all familiar with, is called the funny bone, which can give you an electric shock into this side of the hand. When we're looking at people with radial-sided pain, as was previously shown on the bony detail, we worry about the distal radius because people fall down and they hyperextend their wrists always to catch their fall. The patient will also frequently be holding onto a steering wheel and have a hyperextension injury to the wrist as well. Frequently that will involve a fracture of this distal radius, but we spoke about a very small bone in the very center here called the scaphoid, which also can be fractured. And the tubercle of the scaphoid is on the thumb side and very painful in this area. Other things we have to take into consideration in the same area is through this tunnel goes a tendon that I'll show you in my hand, extends the thumb like so. When that itself is injured, it goes through a small tunnel and it becomes tight, or stenotic would be the name that we use. In that, people develop a tendinitis, and it has a very specific name called de Quervain stenosing tenosynovitis. This can fool people into thinking there's a fracture, but frequently this will respond to just tendinitis treatment. People also in the very same area will have arthritis at the base of the thumb, particularly, can you pinch my finger, John? Specifically when pinching, there's increased pressure at that joint. Just relax for a second. At that joint, there's a trapezius and the metacarpal, and people will frequently have problems with arthritis at the base of that joint. So that all has to be differentiated just with pain anywhere in this area. On the other side of the wrist, or the ulnar side of the wrist, people will frequently have injuries, particularly in an accident, with these bones at the very base of the ulnar side, and these are called the ulnar metacarpals. Frequently, can you make a fist? Frequently, people, when they fall, will fall on their knuckles as so, and in that case, people can get what's called a boxer's fracture, which is a fracture of this metacarpal bone due to the impact. Can also happen on the next one called the ring finger. At the same time, just like the radial side, we have to be looking at the nerve that comes down here called the ulnar nerve, comes all the way from the neck and into the hand, as people can get something called entrapment of the nerve in Guillaume's canal. And that will also give pain in this side of the hand. So in essence, this is a way of showing that we have to look at the regional areas of the wrist and then hone in on exactly where the diagnosis is so we have the correct treatments. Again, this is Dr. Morgan emphasizing that what we just reviewed is a small sense of exact injuries that can occur in motor vehicle accidents and slip and fall injuries. And they're usually very highly traumatic injuries. So I would recommend highly that you come and see the professionals at Chambers Medical Group. That is both myself, orthopedic surgeon, chiropractic care, and therapeutic intervention, and all the diagnostic techniques that we can provide to better diagnose and treat the injuries that are sustained.